Welcome to my YouTube channel. In this video we will discuss about feline calcivirus infection, which is usually a disease of cats. There are different characteristics of calcivirus. Firstly, they are non-envelope secondly they are single-stranded, thirdly they have isohedral symmetry. Uh, FCV is commonly respiratory disease in cats. It usually attacks respiratory tract like lungs and nasal passages of mouth, with the ulceration of tongue, intestines, and musculoskeletal system. A common viral disease of domestic and exotic breeds characterized by upper respiratory tract signs and ulcer in mouth. Occasionally, inflammation of the joints and known as arthritis. It is highly fatal mm, and generalized disease with bleeding and fever. Upper respiratory tract, also known as upper airways, include the nose, nasal passages, throat, and windpipe. Lower respiratory tract involves the bronchi, bronchioles, and alveoli, in which oxygen and carbon dioxide are exchanged. So, this disease attack upper respiratory tract and lower respiratory tract. The transmission of disease depend on various factors. The virus is readily transmitted between cats through direct contact, through contact with saliva, ocular or nasal secretions, through inhalation, through sharing of food bowls and litter trays, contaminated environment. Okay, now we will discuss about clinical findings. Acute respiratory infection, acute URI, is the most common manifestation of FCV infection. Typical signs include sneezing, nasal discharge, ocular discharge, conjunctivitis, ulceration of the tongue, lethargy, inhabitants, and fever. Signs may last from a few days to few weeks and vary in severity. In young kitten, the virus may also cause pneumonia. Stomatitis is also common. Chronic gingivitis is common disease in cats, and it is thought that persistence of FCV infection in these cats is part of the cause of gingivitis. This is not a simple disease, as other cats exposed to virus from a cat with chronic gingivitis will usually only develop under respiratory signs. Uh, limping syndrome is also a clinical finding of this disease. Well, limping syndrome is common in young cats. Infection with FCV may also cause joint inflammation, which is known as arthritis. This is a transient problem, usually only lasting a few days, but the kitten or cat may be extremely uncomfortable with painful joints during this time. Often, but not always, there will be signs of URI at the same time. Well, virulent systematic FCV infection, which is known as VSFCV. One rare occurrence on occur outbreaks of disease have been reporting with very much more pathogenic strains of FCV termed as VSFCV. This can result in severe disease including pneumonia, hepatitis, liver inflammation, pancreatitis, skin swelling, ulceration, and bleeding from the nose and intestine. Fortunately, these outbreaks are very rare, and diagnosis depend on various factors. In most cases, diagnosis is based on the characteristics, clinical signs, especially if ulcers are present. Diagnosis may be confirmed by collecting samples of discharge from the mouth, nose, or eyes and submitting these samples to a laboratory for specialized testing such as viral isolation and identification. Second, PCR. Third, immune histochemical staining. If a cat is showing sudden signs of lameness, X-rays may be recommended to rule out other causes such as injury. Clinical disease usually appears 3 to 4 days after exposure to calcivirus. Clinical disease usually appears 3 to 4 days after exposure to calcivirus. Once antibodies appear about 7 days after exposure, recovery is usually rapid. Prognosis is excellent unless severe pneumonia or generalized systematic bleeding disease develop. Recovered cats persistently infected for long periods will shed small quantities of virus continuously in their secretions. So this is the prognosis, and now we are moving to our treatment. Well, there is no specific medication to eliminate these virus. This virus is very dangerous. Most cats with an uncomplicated calcivirus infection can be treated symptomatically. Okay, broad spectrum antibiotics may be indicated, such as amoxicillin, antibiotic eye ointments, appropriate pain medication for the inflammation of joints, arthritis will also be used. So this is the treatment of calcivirus in cats. Now we move further toward our treatment based on symptoms. Cats with nasal or airway congestion may benefit from increased humidification, such as being taken into a steamy bathroom for 10 to 15 minutes several times per day. To minimize irritation from discharge, it is often helpful to wipe them away from the cat's face or eye with a moist tissue. If decreased appetite, feeding a slightly warmed, highly palatable canned food may be helped to improve their appetite. In some cases, an appetite stimulant may be prescribed. Control and prevention. Preventing direct control between your cat and other cats will greatly minimize the chance that your cat will pick up an infection. In addition, following good sanitation and hygiene practices will reduce the chances of transmission of infection. Objects that have been contaminated with calcivirus can be disinfected by soaking for at least 10 to 15 minutes in a solution by bleach. Bleach is very important in control of calcivirus. There is a method to prepare a bleach solution. Take 1 part of bleach and put it into 32 parts of water. In this way, you can prepare a solution which can be used to disinfect objects that have been contaminated with calcivirus. All cats should be vaccinated at the same time. They are vaccinated against feline herpesvirus 1 and feline parvovirus. Okay, well, routine vaccination with either modified live virus vaccine or inactivated vaccine should be done as early as 6 weeks of age and repeated every 3 to 4 weeks until at least 16 weeks of age. Okay, breeding catarrhs respiratory disease is a problem. Vaccinated kittens at an earlier age, either with an additional vaccination at 4 to 5 weeks of age. Now we are moving to control and prevention. American Association of Feline Practitioners classifies feline herpesvirus, feline parvovirus, which is also known as panleukopenia, and feline calcivirus as core vaccines. Vaccinate all your kittens, cats with these three agents on the initial visit as early as 6 weeks of age. Repeat every 3 to 4 weeks until 16 weeks of age and 1 year after the last kitten vaccination. Revaccinate it for calcivirus for every 3 years. Okay, so do you have any questions? There are samples and tests which we can perform according to disease, and we check it according to diagnostic test. Well, swine vascular